That's good.
So I'm David Harrington. I'm co-founder of United for Brownsville and director of strategy. And we're building a neighborhood where every family can flourish. I'm going to tell the intertwined stories of the founding of United for Brownsville, our work in early intervention, and the creation of the early intervention ambassador role. Through this work, we eliminated longstanding disparities in access to early intervention in Brownsville. And we didn't do that alone as a small team. We did it with the help of many partners who are in this room right now. I'm also looking out the window and trying to see Brownsville behind me. I can't quite see it, but I can see lots of Brownsville in this room. When we did that work, we developed a model built on local collaboration, partnership with the Department of Health, and the trust building work of the early intervention ambassador that we believe can work anywhere in New York City and even beyond New York City. Today's event is really full circle for me. My first external meeting at United for Brownsville was actually a roundtable of early childhood initiatives organized by Citizens Committee for Children. And that roundtable became the EI Equity Collaborative that is here today. We had no idea what direction that work would take, but it's come full circle for me today. So I'm going to take you back to the beginning for me. So United for Brownsville started in January of 2018 with a grant from the Robin Hood Foundation and a mandate to use collective impact as a method to improve early childhood developmental outcomes across the neighborhood of Brownsville, Brooklyn. I was a parent of a young child at the time. I worked in the Department of Education, and my co-director, Casa Balai, had worked for ACS. We had absolutely no idea how we were going to achieve what we had been told to achieve with our grant. We were two dudes from outside the neighborhood who biked around, and we had some scotch tape and maybe winning personalities, but like no plan. And the answer was that we couldn't do it, or we couldn't do it ourselves. And the only way that we could do this was that we had to work with the local experts. And for us, that meant two groups of people. One group was social service providers, healthcare providers, educators, and others who are already working with families of young children every day. And we organized a group called the Provider Action Team, which you can see on the right, some of the logos of the organization on the right. And then the other group was the real experts, which became the Family Advisory Board, a group of local mothers, fathers, and caregivers who are raising or had raised children in the community. And from those groups, we wanted to know what was working in the community, what could be improved, and their ideas for improving it. And those groups began to meet regularly and have been meeting for 8 years now. So our first step, it wasn't to launch a program, it was to organize groups. And very early on at the first meeting of the Family Advisory Board, when we asked them to steer us in the right early childhood outcomes, they directed us to early intervention. And they felt that early intervention could be very impactful when it was received, but that many families weren't receiving it who could benefit from it. And they had a lot of reasons why it might not be received. They talked about bias against early intervention within the community and bias against the community by providers. They talked about stigma about early intervention, and they especially talked about a lack of trust in public systems. And then one mother on the Family Advisory Board told a story that I could never forget, which is about raising her first child in a wealthier neighborhood. When she had developmental concerns, she was sort of directed towards early intervention and received services and had a terrific experience. Raising her second child in Brownsville, she told her pediatrician she was concerned about that child's development. He told her to stop reading those baby magazines. She actually did get a referral to early intervention, but when the evaluator came to our house, her partner refused to allow the evaluator into the house. And so the child never received services. And in a nutshell, that really exemplifies all the barriers that many families in Brownsville and elsewhere in New York City were facing when it comes to early intervention. When we brought stories like that to the Provider Action Team, we also heard a lot of the same things from the other side of the coin, right? And there was a general sense that many families in Brownsville, many children in Brownsville who could benefit from EI were not accessing those services. But the problem was we had very powerful anecdotes, very powerful theories like this but we didn't have any data. So without the data, we couldn't understand the scope of the problem. And if we were going to try to do some projects together to improve things in Brownsville, we couldn't know if we were having any impact. And something began to change late in 2018. So late in 2018, we got to meet the Bureau of Early Intervention, Lydia Ledniak, and Nora and Jeanette and the team. And they told us something really important, which was that everything families are saying, everything providers are saying is right. We have the data that shows that in Brownsville, not enough Black children are being referred to EI, and not enough Black and Latino children are getting through the enrollment process to receive services. And that was really, really validating for us. They also told us that they had a commitment to equity, and that when they tried to reach out to communities directly, they weren't always seen as a trusted partner because they were the system. But we thought maybe there could be a partnership between the department, between the local stakeholders we'd organized together, and maybe we could do something together. And so there was a big turning point for us. And the turning point is actually partially captured in this photo of the Family Advisory Board on the left side of your screen. So that photo is from the 1-year anniversary of the Family Advisory Board in the summer of 2019. And at that meeting, we were able to review for the first time data that the Department of Health had released to Brownsville showing the disparities in access for children in Brownsville to early intervention services. And that was a really, really important moment for the group, a pivotal moment where we can move from talking about a problem to acting on a problem. So here's a snippet of some of the data. And this is looking at what I call the rate of EI service receipt in Brownsville and New York City. And what I really want you to pay attention to is the dark blue line at the bottom. So this is 2017 and 2018. The dark blue line is Black children in Brownsville. And at the time, the Black children in Brownsville were about 50% less likely than white children in New York City and to receive early intervention services. So that was very, very striking at the time to find that out. But it really had unlocked something for us. One, it began to restore trust between the community and the system because the system had given the data to the community that it wanted to receive. So even though the data was very stark, Brownsville, the Family Advisory Board felt like we can do something with this data. And it also began to unlock some action. It also gave us a common understanding with the provider action team with families of the challenge that we were facing and how we might achieve something. And I don't have time to talk you through all the work that we did together, but this driver diagram represents some years of planning that we did. And what we were able to do with this was ask the question, what do we think needs to change in Brownsville if we want Black and Hispanic children to access it at equitable rates in the community, access EI at equitable rates? And we came up with a number of projects and theories that we could test against the data and see if we were making an impact. And the key project that we came up with, sort of at the center of this diagram, called the Family Ambassador, is what became the EI Ambassador, which is what we're here to celebrate today. And it's important to note that the EI Ambassador is a role that was co-designed. So it was co-designed with members of the Family Advisory Board, with members of the provider action team, with thought partnership from the Bureau of Early Intervention, as someone who could sit between families and the system, someone who could be a trusted partner, who could speak the language of systems and speak the language that families need to hear in order to get them through the logistically difficult and emotionally difficult process of being referred to and enrolling in early intervention services, and also transitioning out of those services into preschool special education if needed. And I'll let Danielle Herring and other early intervention ambassadors talk more about how that work looks in the context that they do it. And it's really exciting. I wish I could talk about it, but they'll do a much better job of talking about it. What I can share is some of the impact of that work. So this data slide is a continuation of the data that I showed you before. And so track the blue line again. So again, service receipt rate for Black children in Brownsville. We started our work in 2019. We were able to hire an EI ambassador in 2021. And 2022 and 2023, we'd achieved what we saw as equity for the neighborhood. So Black children in Brownsville were receiving EI services at about the same rate as white children and children of all races citywide in New York City. And there's still a lot more to learn. There's a lot that goes into moving the needle that way. And there's also a lot to address to keep those numbers up, because there are particular challenges happening in the wider political context and in systems right now. So it requires a lot of input to keep that going. But I'm really, really proud of the work that went into this. That was not just the work of one organization, but of so many people in this room and outside this room. And then I also want to point out that this is not just the work of United for Brownsville, the PAT, and the FAB. Just as United for Brownsville acts like a collaborative in Brownsville, Brooklyn, we've been doing the work in partnership with other people citywide. So through our collaboration with Citizens Committee for Children of New York, with funding from Gutman and Mother Cabrini Health Foundation, we've been able to share data. We regularly share practices, methods, lessons learned with other partners across New York City. So in Upper Manhattan, we have Link and New York Presbyterian. We have Children's Aid operating in the South Bronx. And we have the Staten Island Alliance for North Shore Children and Families meeting regularly, sharing practices. And 8 years later, we've come full circle. What started as people sitting in a room, sitting around a table, wanting to make an impact and unsure how, has turned into a model that can operate citywide and beyond New York City to give every child the education and access to services that they deserve.